Good evening, everybody. Welcome to the November 2020 Life Lecture featuring Patricia Rogers, who is a diplomate level craniosacral therapist. Craniosacral therapy is a gentle hands-on therapy that is deeply supportive of the body's parasympathetic or rest and digest nervous system. This life lecture is going to begin with a brief overview of craniosacral therapy, including the advanced techniques of somato-emotional release. This will be followed by discussion about opioid recovery and applications of craniosacral therapy for that population. And then she'll close with presentation of two cases in which craniosacral therapy was used as part of an integrative opioid recovery program. She is, again, an advanced certified craniosacral therapist at Body to Brain Therapy in Charleston, West Virginia. She's a graduate of Marshall University and holds professional licenses in West Virginia, as well as Ohio and Florida. She is an advanced preceptor and teaching assistant for the Upledger Institute in Florida and serves as a primary therapist at intensive therapy programs for Integrative Intentions, which hosts dolphin-assisted therapy programs in Grand Bahamas, as well as equine-assisted programs in other locations, and offering classes, study groups, workshops, therapist retreats, and presentations. She was an invited primary therapist at the Alzheimer's Research Intensive Therapy Programs of the Upledger Institute in 2018 and 2019. So this evening, we welcome Patricia Rogers to talk to us about craniosacral therapy and opioid recovery. Patricia, thank you for being here.
Thank you so much, KJ and Jennifer. I appreciate your inviting me to join this group. First of all, just wanting to make sure you all can see my screen. You can see the presentation?
Yes.
Okay, and then just kind of repeating what Jennifer said, feel free to let me know, just unmute yourself if you have a question along the way. You know, I can just be pretty fluid with this because I don't want you to feel like you're getting lost or getting bored just listening to one person talk the whole time. And I think that's all the housekeeping I have. Oh, just if you, I'm not sure I know how to see if you type something in the chat. So if you do that and it doesn't get my attention, give me a holler audibly, somebody. Okay. All right. So craniosacral therapy and opioid recovery. Oh no, do we already have a, oh, there it is, okay. There was a delayed response there. I was hitting the button and nothing was happening. So again, I work at Body to Brain Therapy, which is in Charleston, West Virginia. And so I do craniosacral therapy, and I also practice somato-emotional release, which is a natural extension of craniosacral therapy. And so to start with in this talk, I'm going to do a very brief overview of what those two therapies are. And you know, some of it is going to be a little bit dense for some of you. Maybe it's going to, maybe for some of you, you're going to want a little bit more detail. But I've just kind of tried to ride the middle as far as how much detail I'm going to give. But it's going to be a pretty fly-by-night overview of the therapy, because I think that probably the best way to understand what the treatment really looks like for opioid recovery is to cover case studies. And so I'm going to present two different cases to you that I think help you to understand how this therapy is applied to this population. And then I'll just open it up for whatever questions you may have. Hopefully I'll be able to answer some of them. Okay, so let me move this here. So craniosacral therapy is a hands-on bodywork therapy. It's a very non-invasive light touch therapy. So basically a person lays down on a treatment table, like a massage table, usually fully clothed. They take off their shoes, maybe a belt or glasses. And so it treats the person as a whole. Meaning that whatever they present with is what we're going to work with. And it really doesn't, you know, like some different types of therapies may be very specific to, okay, you have a knee injury, so we are going to work on your knee. Or maybe somebody comes in to a mental health therapist and they have some issues with depression. And so we're going to work on, you know, the mental health issues regarding depression. But this therapy really treats the person as a whole. So today, with the overview of the therapy, I'm going to talk about 3 different systems of the body that are treated through this therapy. I'm going to talk about the fascial network. I'm going to talk about the nervous system and the craniosacral system. I have a delay for some reason. I'm hitting my, oh, I don't know. Okay, the keyboard isn't responding, but my mouse does. So there we go. Okay, so sorry about that. So again, it's a very light touch. So if you'll imagine the weight of a nickel resting on the back of your hand, that is how light this touch is. So it's going to be far less than just, say, the weight of my hand resting on the surface of someone's skin. And this very light touch is held over a long period of time. And what happens is that the fascia, or the connective tissue of the body, can begin to, we often use the word melt. It softens and lengthens underneath that very light touch. And so this has the effect of relieving scar tissue. And so, you know, what you see here in this figure is the connective tissue of the body. It's really a network. The connective tissue, it covers all of the structures of the body from head to toe. And so treating the fascia, you know, we may be treating one part of the body to work with an underlying strain pattern that is in a very different place in the body from where a person is experiencing symptomology. So that's the fascial network. The nervous system. So we do treat the central nervous system, which is the brain and spinal cord. And then we also treat the peripheral nervous system. And in particular, we really focus often on the parasympathetic nervous system, the rest and digest. So one of the hallmarks of craniosacral therapy is that it is able to bolster the parasympathetic nervous system, the rest and digest. It's able to help the nervous system to very deeply relax. And what we know is that the body's natural healing mechanisms are best able to occur in that deeply relaxed state. And so that's kind of one of the focal points of craniosacral therapy. So craniosacral system, what even is that? So the craniosacral system is the brain and spinal cords and the membranes and the fluids surrounding the brain and spinal cord. So what you see in this slide is in the background, there is, you know, the skull, and the brain has been taken away. And what's left here in this image is the areas of the brain where fluid is contained. So these areas in the middle are ventricles. And the ventricles are where cerebrospinal fluid is created as a filtrate from the blood. And so cerebrospinal fluid leaves the ventricles and enters the subarachnoid space, where it then bathes the brain. And once the volume of cerebrospinal fluid increases to a certain tipping point, the cerebrospinal fluid then exits through the venous sinuses and returns back into the bloodstream. And this production of cerebrospinal fluid as a filtrate of blood occurs at a constant rate. But the return of the fluid back into the bloodstream happens intermittently. So what occurs then is that the volume of the cerebrospinal fluid is constantly in flux. The volume increases and it decreases. And that creates the craniosacral rhythm. So the craniosacral rhythm is a natural rhythm that occurs in the body, similar to the breath or the heart rate. It's more subtle, but it's created by this ebb and flow of cerebrospinal fluid within the membrane system. And so, it's exaggerated in this video here, but what you're seeing is an expansion and contraction of the cranium with the flow of the cerebrospinal fluid. And in this video, these gray areas are parts of the skull, and then they're being taken away so that then you can see this gold area. And the gold represents the cranial membranes, which are the membranes, the fascia, the connective tissue within the skull that is in between the different lobes of the brain. So this craniosacral rhythm can be palpated on the cranium and then throughout the body, actually from head to toe. With training and palpation and practice, you can feel the craniosacral rhythm from head to toe. Obviously, it's more subtle than in this video. You can't actually see people, their heads moving back and forth, but it can be felt. So Dr. John Upledger was the developer of craniosacral therapy, and he was a DO. He started with his work in an autism clinic, and it developed out of his work with children with autism. What he found with those children is that the cranial membrane systems, the gold areas in that last slide, those membranes were cinched really tight in children with autism. And what he found with his osteopathic manipulative techniques working with these children is that as those membranes began to relieve their restrictions, their scar tissue, and expand and lengthen, then the children with autism began to have different kinds of emotional releases. And with those emotional releases, then they had different kinds of social advances. They were better able to express themselves, and they were better able to have bonding with their parents. And so then he expanded the work from his autism clinic to people in all different types of populations, children and adults, and eventually developed what are now known as somato-emotional release techniques. And really, there's no for an advanced craniosacral practitioner, there's no distinction in a session between what is craniosacral therapy and what is somato-emotional release. It really just depends on whatever a patient presents with. But somato-emotional release techniques give additional tools of therapeutic imagery and dialogue that can help to get to some of the underlying emotional issues that may be contributing to physical strain patterns or different injury or disease within the body. So somato-emotional release, again, therapeutic imagery and dialogue techniques. So basically what that means is that when emotional things come up, or when there are underlying emotional issues that a patient is not aware of that are contributing to physical strain patterns, there are techniques that we utilize to help that subconscious or non-conscious material percolate up into the conscious awareness, and being consciously aware of emotional issues helps facilitate the physical healing process. This is particularly powerful for the integration of trauma. So what happens quite often with trauma is that somatic memories are held within the tissues of the body. So, the mind remembers things in one way. The body also remembers things in a different way. And so these therapeutic imagery and dialogue techniques help to integrate those traumatic experiences and bring awareness into the conscious level. And when that occurs, then there is the facilitation of physical healing. And those emotional issues no longer still have the same pull or the same kind of drawback in a person's life. They're able to recall those memories without that negative or destructive emotion associated with them. So does anybody have any questions so far? I'll just ask here for a moment if anybody wants to chime in with anything. Some of you I can see on my screen right now, and some of you I can't. So, okay, I'm not hearing anything. So I'll just charge forward. So I'm not going to go into a lot of detail about what the opioid addiction crisis problem is. I think that I would say it sounds like we have a few people on this call that are not West Virginian. I think most Americans are pretty familiar with the opioid crisis and the the extent of the problem. And I would wager that many people in West Virginia, maybe most people on this call, have either had someone in their family or a coworker or a friend who has been impacted some way with the opioid crisis. So, so the good news is that that some things are happening that are helping. So here in Charleston, a doctor of osteopathy worked on a state opioid response system grant and got coverage for an integrative program. And it offers craniosacral therapy as a non-pharmacological pain management treatment. And so it's a very integrative approach. The patients from this program see a physician who prescribes to them medically assisted treatment in the form of Suboxone or methadone, and they have access to any kind of subspecialists they need in addition to their primary care. And then they have access to acupuncture, physical therapy, craniosacral therapy, yoga. I'm missing something in there. They get osteopathic manipulative therapy as well. And so all of these things are being used in combination for these patients in an outpatient program to address their opioid addiction. So now I'm going to talk about two different cases. Oh, no, I'm not. Look, I've messed up my slides. Okay. So I'm gonna do an overview of the kind of different ways that craniosacral therapy can be applied to this population, and then I'll talk about the cases. So first and foremost, rest and digest. If any of you have known someone who has had trouble with opioid dependence, or maybe you have yourself had that personal experience, one thing that can be a hallmark of withdrawal is anxiety. And so the nervous system is just really out of whack, right? The parasympathetic nervous system is not well supported, and the sympathetic nervous system, or the fight or flight nervous system, is kind of amped up, right? Even maybe more so than other Americans in the high stress life that we had before pandemic and now than during pandemic, of course. So, so these people really need nervous system support to help relax the nervous system into rest and digest. And like I said before, craniosacral therapy is really a valuable tool for doing that. So here in this diagram, you see the sympathetic nervous system is here in pink, and the parasympathetic nervous system is here in blue. And so craniosacral therapy really works to support the nerve pathways to all of the organs that are involved in helping the body to rest and digest, to relax. And so with all of this innervation of all of these vital organs, these are all involuntary functions of the body, and the craniosacral system, the craniosacral therapy helps to support parasympathetic dominance. So brain function. I think if most of you maybe were around for the commercials of the 80s about the egg, and this is your brain, and this is your brain on drugs. then you know, most of us are aware that there's a pretty significant impact that occurs with drug abuse, and that is certainly no exception for opioid abuse. So this is a spectrogram, and it shows basically on the left you have a healthy brain, on the right you have a brain that has significantly impacted brain activity after 7 years of opioid abuse. And so craniosacral therapy has the ability to actually treat the tissues of the brain, to impact brain function. So I didn't really talk too much. I talked about the light pressure and how that impacts the connective tissue. But you know, knowing the anatomy as you sink into the blending and melding with this light pressure with the craniosacral therapy, you can connect with deeper and deeper and deeper and deeper levels of tissue within the body. And knowing the anatomy and the way that things are connected, eventually you can get all the way into the tissues in the center of the brain to help them with brain function. And you know, one of the vital things that craniosacral therapy does, again, is impacting the fluid flow within the brain, improving the flow of cerebrospinal fluid. And so as we enhance the flow of cerebrospinal fluid in the brain, it's helping to detoxify, it's refreshing the cerebrospinal fluid, it's helping to output at an increasing rate the old cerebrospinal fluid back into the bloodstream where it can be circulated and cleansed, and to enhance more production of cerebrospinal fluid. Okay, so reward centers. So these are some structures within the brain, and I won't go into too much detail with this. I don't want to bore you all to tears with neuroscience, but the reward system is the kind of a combination of areas of the brain that are involved in helping us to make connections between stimulus and pleasure, and then to use those stimulus and create positive behavior patterns that help us in our lives to navigate the complex world that we live in. So for instance, if we eat a delicious food, then we feel a pleasure response from that. And then we learn to create a behavioral pattern where we seek out that delicious food to eat again. And that delicious food provides our body with nourishment. So what happens with drug abuse is that this system gets all out of whack. The opioids create dangerously high levels of dopamine release. And over time, drug abuse, opioid abuse in particular, can actually rewire the reward center of the brain. And so then what happens over time is that you know, you'll hear people talk about losing their moral compass, starting to choose behaviors they would never have chosen to before drug abuse, acquire the drugs that they seek, because there's such a strong connection between the association of the drug and the pleasure response. And so they lose all function of their reasoning, and they begin to, you know, just have behaviors that that don't make a lot of sense. And then over time, they even lose the sense of pleasure that was originally associated with the drug. And with long-term drug abuse, then the drug is required just to feel normal. They no longer get high from feeling the effects of the drug. They don't have that pleasure response associated with it, but they do still have that desperate seeking behavior to get their next fix so that they can just feel normal. So with craniosacral therapy, we can treat the different structures of the brain to help to repair the damage that's been done to the reward center. Pain management. So a lot of people came to opioid abuse through the original treatment of some pain pattern. Some people abused whatever opioids were available to them off of the street and developed their drug abuse from that pathway. Some people had pain, they went to the doctor, they were prescribed medication, and that went haywire for them and turned into drug abuse. And so what we find with chronic pain is that there are specific areas of the brain that are associated with the processing of pain. And with chronic pain, these parts of the brain can be facilitated. They can be overactivated, and it can kind of create a pain cycle of its own. In other words, there's the original source of the pain. Let's say it's, you've got knee pain, and that is a chronic pain. Over time, you feel that pain. And then the parts of the brain can become facilitated and kind of take on a life of their own, so that it's not just the experience of pain is not just dependent on the source of the pain at the knee. It's then also fluctuating because of hyperactivity of these particular structures in the brain. So craniosacral therapy, again, can help to defacilitate these areas of the brain and to normalize brain function to kind of begin to manage the pain cycle. Trauma. So I don't think it comes as a surprise probably to anyone that most people that have been in a cycle of drug abuse have experienced a significant amount of trauma in their lives. If not before the drug abuse, then during the cycle of drug abuse, with all of the chaos that occurs through the lifestyle of drug abuse. And like I said, trauma, well, I'm not sure if I've actually said that in this talk yet, but craniosacral therapy is one of the best ways of treating trauma that I know of. And I actually speak as a person who has a history of PTSD and came to this work because of that history. I really don't know of anything else, and of course I'm biased, right? Because it's the pathway that I took, and it's the pathway that I chose to pursue as a professional career. But I don't know of anything else that's better at getting to the underlying sources of nervous system dysregulation and with the emotional issues of the somatic memories of trauma than craniosacral therapy to address those issues. Okay, so now I think I'm ready to go on to the case studies, but I'll just open it up again if anybody has anything they'd like to chime in with.
Patricia, there are a few questions that kind of popped up here. Let's see. There was a question that says, can this be helpful for ADHD children as well?
It is, yes. I'll have a slide at the very end that has kind of an image that shows lots of different types of things that can be treated with craniosacral therapy. Absolutely, ADHD it involves a lot of nervous system dysregulation, and craniosacral therapy can be quite helpful for that population.
Okay. And another question, can this help to improve cognitive function as well as regrow dendrites that have been damaged due to substance abuse and addiction?
Yeah, okay, so I have seen, just wanting to choose my words, I suppose. There is a significant impact on the way that the brain functions over time with this treatment and the way that cognition occurs, yes.
Okay.
Yeah.
And maybe you mentioned this before, but I know you said that sometimes when it comes to substance abuse, there's a lot of trauma that goes along with that. But what if somebody doesn't actually have like a drug abuse issue, but they have a lot of trauma?
So yeah, so that's perfect. Drug abuse kind of compounds the issue and it makes it a little bit more complex, but absolutely, whether or not there's a history of drug abuse, PTSD is very well suited for craniosacral treatment.
Okay.
Yeah. And I'll add here, I'm not trying to promote that craniosacral therapy is supposed to be a standalone treatment. John Epledger always meant for it to be an adjunct to whatever else is working in a person's life. So, it can work very nicely with whatever else may be helping a person manage their trauma, their history of trauma in whatever way. Anything else before we move on? Okay, thank you, Jennifer. Oh, sorry, my mouse is touchy. Okay, so the first case that I want to talk about is just a single session. I just want to talk about that one case as a single session, and then the second case I'll present will be a series of many sessions over a period of months. Just take a drink. So this case was a young early 30s Caucasian female. She talked with me before she came in, and she let me know she had very severe anxiety. And she had a codependent relationship with her husband. They were both in drug recovery, and really, she didn't much allow for her husband to be away from her for any period of time. And so he was to come with her to her appointment. She saw him as her protector, and she felt like she just was not safe in the world without him right by her side. So I had them come into my treatment space here at the office in Charleston, and to begin with, she got on the table and she didn't express any concern with starting the treatment, but I started very gradually to approach her and started to have a sense that she was not necessarily expressing her fear the way she was feeling her fear. And so I began the treatment very slowly. And after just a few moments of having my hands on her for the treatment, she did begin to relax. She relaxed somewhat, and I started to do still points with her, which is it was a technique that helps to kind of reboot the craniosacral rhythm. And so with these still points, she went into a deep relaxation over a period of several minutes. But the state of relaxation was so foreign to her that it was actually a trigger that caused her to sit bolt upright on the table in a state of just panicked fear. She didn't understand what was happening, and she was just very, very frightened. So I used some techniques that I've learned through my own trauma training to help her to engage, to reconnect with her body, to reconnect with her senses, to feel her awareness that her body was in a safe space in the present moment. And so I invited her to, hear what she hears in this space, see what she sees, feel the air on her skin, the weight of her body on the table. And as she began to really connect with the reality that she was safe in the present moment, then she began to become comfortable with beginning to receive the treatment again. So we started the treatment again after she was ready for me to have hands on her again. And then she was able to get to a far deeper state of relaxation. And I really spent the whole system just with techniques geared toward deepening her parasympathetic response. and she got amazing results from the session. And so within a 60-minute session, she went from being basically completely intolerant of touch to so deeply relaxed that she was almost snoring, and the whole concept, the whole experience of relaxation was completely foreign to this woman in her early 30s. So that gives you a kind of an idea of what maybe a first session with a patient in this population would look like. And so now I'm going to talk about a second case. So this is a woman, Caucasian. She started drinking at age 12. She was in an auto accident when she was 18. She was prescribed opioids at that time. And that was at the time when, opioid overprescription was kind of in its heyday in this state. And she was connected with a doctor that grossly overprescribed. And so I met her in June of this year, and she had 7 months sober for the first time since she was 12 years old, and she was 40. So not surprisingly, with that kind of history of substance abuse, she had a lot of damage to a lot of systems, to all of the systems of her body. She had an L1 compression fracture. I really try to be cognizant not to induce kind of a secondary trauma when I talk about things, but it is important to, I won't give detail, but I'll just mention in general, the compression fracture was from a domestic abuse. She had degenerative disc disease, spinal stenosis, lots of issues with hormonal imbalance, carpal tunnel syndrome, liver cirrhosis from hepatitis. She also had inflammation of the spleen, eating disorder, and diabetes, and not surprisingly, a history of PTSD and fibromyalgia. So it's a very complex physical situation that she brings with her, and emotional. So I want to talk about the progress that she's had over the past 5 months on seven different levels. So basically, let's see, now it's been 53 sessions in the past 5 months. So anywhere between 8 and 12 sessions per month, she's come in for treatment. And so these are the seven different types of progress that I'm going to report to you that she's been having. And by the way, in case you were curious, I do have permission from this patient. She was happy for me to share on this talk. She knew that it was going to be recorded and shared on Facebook, but her perspective was really that she is happy for anybody to learn from her experience if it can help in that way. She finds fulfillment in that. So we're going to talk about her anxiety relief, pain management, the renegotiation of trauma, and the memory integration that she's experiencing, neurogenic bladder, lymphatic circulation, the reward center treatment that she's had, and peripheral neuropathy. So, so here's a chart that shows her anxiety measured over the first 24 sessions that she was treated. So basically the first 2 months of treatment. Zung Anxiety Index is an index that's it's a survey that's administered for the patient to rate anxiety on a variety of different levels. And it rates the anxiety in different categories. And so the highest category is most extreme anxiety. And then the next level down is moderate to severe anxiety. So it rates a significant difference between her anxiety during the first 12 sessions, and then from 12 sessions to 24 sessions, her anxiety made a significant decrease. And that's basically just through support of parasympathetic dominance and helping her body to begin to feel a sense of safety. Pain management. So this is kind of a busy slide, but here you see, basically this is the brain. This is the brain stem, and this represents a spinal cord. Anywhere place in the spinal cord would be facilitated or disrupted in some way. This is a segment of the spinal cord. And so, like I said, she has a compression fracture in her lumbar spine. And so the spinal cord is impacted in that area. It's impacted in other areas as well. But one treatment in particular, it just became very clear that a treatment of the spinal cord in the area where her lumbar fracture occurred then translated to, through the neural pathway to a big facilitation in the brainstem here, which is part of the area where pain is processed. And so then it also translated to an area in the thalamus and an area, actually in this diagram, the gray doesn't come down through here, but the genital portion of the somatosensory cortex is located right in here in this area. And that's part of the area of the brain that I was treating while I was treating in the same session while I was treating this area of the spinal cord that had been injured. And so, again, not to go into too much detail, but this patient had sexual abuse when she was 6 years old. And so there is a very direct correlation in this particular session that I was doing between disruption in the part of the brain that governs the genitalia, to the thalamus, to the reticular formation in particular of this area of the brainstem, and then to the spinal cord. And so treating all of those parts of this pain pattern helped with the pain. And then continuing over many sessions to treat this area of the brain, the reticular formation, helped with the anxiety response that she has and how it interplays with her pain. So she has waves of pain and waves of anxiety, and there's this interrelation between the two. And so treating this whole system, but then in particular treating this area of the brainstem, has been quite impactful over a period of time in helping with that pain pattern. Trauma renegotiation. So, as I showed you in the beginning, anxiety began to decrease over the first 24 sessions as she was benefiting from the parasympathetic support. In session 24, she began to report she was having racing images. That's what she refers to them as racing images or racing thoughts. Many people, the more common term for them is flashbacks. And so flashbacks occur when there is a traumatic memory that the brain has worked to repress. So because it's a common thing that occurs with post-traumatic stress, the brain has a savvy way of helping forget those memories that are too painful to remember. It's just a survival technique. But what happens is that when a person receives any kind of therapy or finds themselves in a situation in their life where they are experiencing enough support, enough healing for whatever shifts or changes in their life, it's quite common for these images to begin to pop up in the mind as the brain begins to heal. And it's kind of this disjointed process of remembering images or parts of the memory as the memory begins to come back in full. And so she started having those racing thoughts coming up for her at session 24. And so look what happens to the Sung Anxiety Index. So she had decreasing anxiety, and then it jumps up again after 36 sessions, and then it stays constant at 48 sessions. So it's not back to as much as it was after 12 sessions or initially, but it has increased. Now I'm going to read this next slide because honestly, she just says it best. I really realized that the correlation between trauma and how my body reacts to trauma. My mind holds memories. My physical body holds memories too, down to the cellular level, really. I go back to the symbol of the bottle. The cork was almost taken off. A bunch of pressure was moved or shifted. I was able to talk about a lot of things all in one session. Normally, the access to those things, the lid is on too tight. I really think facing a lot of those things I haven't thought about in a long time has to do with not sleeping and depression. On the flip side, I feel more at peace, though, than I have in a long time. And so I just think that is, her words are so eloquent in describing this process. Her anxiety increased as she began to have these flashbacks, as she began to reacquaint herself from memories of her past that had been locked down so tight. Her mind had protected her from those difficult things from her past. So on the one hand, she's having more difficulty sleeping, she's having depression, but on the other hand, she's also feeling somehow more at peace than she has in a long time. So another thing that she has had significant impact with is neurogenic bladder. So later on in her treatment, it was about session 40, she began to kind of address this directly in her treatments. So with neurogenic bladder, she has, first of all, bladder shyness. She is not comfortable with urinating when she thinks somebody else is going to be able to hear her. She also has a very difficult time finding her voice to tell people that she needs to stop and take a bathroom break. She's never really kind of spoken up to tell her needs about much of anything, and it's just very uncomfortable for her to say, hey, I need to pee. Now, she also has a lot of physical issues that are going on. So again, she had sexual abuse at age 6, which had significant impact on structures within her pelvis. So, and she also has the damage of the lumbosacral area with the compression fracture. So there are disruptions within the bladder itself structurally, disruptions within the spinal cord, disruptions I've talked about before with the brainstem. And then you'll notice that the cerebral cortex that governs bladder is also in close proximity to the place I was talking about before that governs the genitalia. So treatment of, let's see, I'll also mention that she has an ability to tell when her bladder is full. She is always getting sensory input. That's this green line here in this diagram. She's always getting sensory input that tells her her bladder is full. And she doesn't know whether that's true or false. And when she goes to the bathroom, sometimes she's able to urinate and sometimes she has to work really hard to squeeze just a few drops out. And so that means these blue lines here, the motor neurons are also negatively impacted in the system. So her behavioral pattern is, first of all, over a long period of time, she has gone for 10 hours at night without ever getting up to urinate. And then she goes out for long periods of time with her driver through the day, and she does not ask to urinate. So 10 hours at night, and maybe as much as 8 or 10 hours during the day, she's going without ever urinating. So only in windows in between is she getting up to urinate. So we treated all of these different parts of this system. Treated the detrusor muscle, treated the spinal cord, L1 through S3, treated the sensory and motor neurons and the brainstem and the cerebral cortex. And so now she is starting to tell her driver she needs to stop for a bathroom break. She is allowing, she uses the word allowing, she is allowing herself to get up once per night during the night to urinate. And I don't think she knows what joy it brings to me, but when she texts on arrival to let me know she's here, she says, I'm gonna run to the bathroom real quick to pee. She's done that the last 3 sessions and it just brings such a joy. Okay. So let's see. So with the treatment of the urinary system, oh, I didn't mention with that, but not surprisingly, over a long period of time, with this pattern of withholding urinating, she's had long-standing urinary and kidney infections, which then of course increases the physical disruption. And all kinds of different issues that she's having. She's got all of this inflammation with so many different visceral issues that she's got. So that's another part of the puzzle. So after treating the urinary system, I then worked with the inguinal lymph nodes, with the delta pectoral lymph nodes, with the axillary nodes, beginning to increase the flow of lymph to help with the inflammation. And so working a lot, especially in here, again, she's got splenomegaly, and she's got cirrhosis of the liver, and she's got a left breast mastectomy. And so working with all of these different viscera, helping the fluid to flow to the lymph ducts. And how cool is this? During her first treatment, where I worked with the lymphatic system, out of a very, very deep state of relaxation, I would have never imagined that I would have heard her verbalize. She said, "I can feel liquid flowing to my bladder." So excited by that. So that's a pretty significant impact. It's not fully treated. There's room for improvement, but I'm really pleased with those results so far. Okay, so the reward center. So this came up later on in this treatment series. And it actually came up during a session where she worked with the emotional issues that she had underlying eating disorder. So I'll just talk about her weight briefly. When she was in her early 20s, she weighed over 500 pounds. When she lost 300 pounds over the next many years, over a decade plus, she lost 300 pounds. And at her sobriety date, which was Halloween of 2019, she weighed 221 pounds. And throughout the period that I've been treating her since June, she has been in her low 260s. So she's maintained a constant weight within her low 260s throughout this past 5 months. So during this particular treatment, where we started working with the reward center, she talked about her history of being on both ends of the spectrum. To begin with, when she was 6 years old, immediately after the initial sexual abuse, her weight exploded. And so right away, as a very young child, the reward center was disrupted as she sought comfort in food. The pathway that's to help you understand, the healthy response between reward and pleasure and behavior was disrupted. Okay, and then fast forward, when she was she had two opposite ends of the spectrum. She lived as a homeless person for a while and in a state of starvation while she was on the streets with her drug abuse. And then she also was in an abusive relationship where she was force-fed. And so she knows all different types of dysfunction associated with disruption of the reward center. And so it was during the session, the treatment started with her stomach, and we were treating. She was aware of it felt to her, she had the sensation that her stomach was a toxic wasteland. And she became aware of that. You know, she has this long-standing habit. She's on a lot of different medications, and each morning she eats once per day. That's just her routine. She eats once per day, and she eats between 7 p.m. and 9 p.m. at night. And she has lots of medications that are prescribed to her. And so in the morning, she takes 12 to 13 pills on an empty stomach. And after many, many, many sessions of coming to me, what presented for her was awareness of her stomach and the discomfort that she had there. And so she began to work with dialogue techniques to understand the relationship between food and self-care. And for a person who has always had eating disorder from from being a young child, it was a revelation to her that she's doing these things. She's doing meditating. She's doing these yoga practices. She's doing mantras. She's getting craniosacral therapy and massage. And now it's a revelation to her. She is suddenly aware that eating is also a part of self-care. So she started talking about the idea of adding eating to her morning routine. She's not there yet. There's more work to be done. I think in her conscious awareness with the dialogue work, also just with the basic rewiring of the brain. There are disruptions of this pathway that have not yet been healed properly to help her with a healthy appetite and having an appetite associated to reward and then eating because of appetite. But I have high hopes. There's been a lot of the work that she's done since that initial session, and actually before it, a lot of the work the brain work that she's received has been in the orbitofrontal cortex. So in this area of the brain where the blue is, and then also expanding down here. And so I think with continued work in that area, I think there is significant hope. So this reward center was disrupted by the eating disorder, and then at 12 she started drinking. It was continually disrupted with the drinking, and then with the opioid abuse. This system has really taken a hard hit. But for her to be able to now recognize that eating is a part of self-care is really, that's a huge step forward. So peripheral neuropathy. So I mentioned in the beginning of this talk that this therapy, craniosacral therapy, treats a person as a whole. And primarily, so far in this session, I have talked about the physical and also about the emotional. But craniosacral therapy also allows for the spiritual part of a person to be taken into account and incorporated into her therapy. And this patient works through an AA program, and through that program has developed an understanding of God. And she refers to that God as, her understanding of God as higher power. And she incorporates that regularly into her visualizations and into her dialogue in this therapy. And she consistently is able to utilize her visualization of higher power to supplement the energy field of her body, which results in a decrease of the discomfort that she feels with peripheral neuropathy. It's not something that she remembers to do. It's something that she requires a cue from me. But whenever she's on the table and I see her wringing her hands or lifting her feet to the ceiling, writhing in pain, it's a familiar thing that happens. I kind of notice that. When I cue her to check in with her higher power, instantaneously the peripheral neuropathy is gone. this patient, she does a lot of work in between her sessions, and she does that work on a variety of different levels. She's really involved in online AA meetings. She loves to journal during those meetings. She journals about things that she doesn't feel comfortable yet expressing out loud with her voice. And she also paints. She finds that painting is almost a moving meditation for her. And she has painted different things that represent her higher power, her energy field, and her sense of grounding. And she blessed me with sharing this with me. This is a painting that she made of her higher power. This was earlier on in her treatment series, sometime within the first 20 sessions or so. She shared this with me. So, like I said, these are just kind of a list and a review of the different levels of progress that this patient experienced with this series of treatments. And the work that she does in the therapy here translates to changes outside the treatments in her life. She is beginning to release her identity as a victim. Sometimes she presents chipper and jovial, and she relates to me casually in a very friendly way. Sometimes when she's experienced a very difficult stressor, or if she has if it's been more than 4 days or 5 days since she's had a session, she can revert back to just, gloom and doom and, the world is against me, which it has been, for all of her life. But that's beginning to lose its hold on her. She's also beginning to release her ownership of pain. She referred for many of her beginning sessions as being pain. She said she is pain. And she doesn't do that anymore. She doesn't think of herself as pain anymore. She's starting to see that pain is an experience separate from her, and that's a pretty significant shift. And so, one of the most rewarding things for me to see is that she's building a sense of purpose. So by session 24, she was reporting that other people were coming to her, asking her how they could get help to get off the streets, how they could get help to get out of the madness and get into recovery. She's working on getting her driver's license reinstated. She's already finished her first level of certification as a recovery coach, and next week she'll be the week after Thanksgiving, she'll be starting into her advanced level recovery coach certification coursework. So I can't tell you what a fulfilling pleasure it has been to work with this patient. So that wraps up that case. Somebody has already asked about, is this applicable for ADHD? I'm sure that's one of the things on this list of words in there somewhere. It absolutely is, but there are a plethora of different emotional, physical, and nervous systems, things that can be treated through craniosacral therapy. Because, like I said, and I don't mean to be too general about what this therapy is good for, but it really treats the person as a whole, mind, body, spirit. So whatever walks through my door is what I treat, and I just use, the whatever it is that they bring to the table is what I work to address. And so here's a picture of my business card. So feel free, anybody who wants to copy down any of my contact information, to get in touch with me. But for now, that's what I had prepared for you guys, and I'll just open it up for questions.
Thank you, Patricia. This is KJ. And, again, I also practice a little craniosacral therapy, and I'm absolutely in awe of what it has done. This has just been a brilliant presentation for us this evening. And I'm really excited with, what you're doing. I am so joyful for this 40-year-old lady. What obstacles she has had to overcome, starting with sexual abuse at the age of 6 and starting to drink at age 12. And yet look at how this gentle, loving work is completely changing her life. And boy, kudos to you. And this is, I'm sure she is just grateful and sings your praises all over the world.
Thank you so much. She's the one that does the hard work. She's the one that keeps showing up. It's really my privilege to have the opportunity to facilitate the work for her. But thanks for sharing that.
Yeah.
Hi, Patricia. My name's Lisa.
Hi, Lisa.
I got in a little late, but it was saved in my Facebook and my reminder came up, and it has been so interesting to listen and to hear that there actually is some people in the area or someone in the area that does craniosacral. A lot of the time when I first started looking into my daughter's ADHD condition, along with some of the other like comorbidities she has, Dr. Almond's like the only one that's come up that's talked about SPECT CTs and, reworking the brain and trying to get, things manipulated. And we've done physical therapy, we've done speech therapy, we consistently do, the IEPs or ISPs with school and the title services. And but none of it really seems to help. And so like hearing that, and I see that you do say that it is therapy for all ages. I'm just wondering, like, what kind of pre-workups do you need? What information do you need? Is this covered by insurance, or is this like completely out of pocket? Like, I know these are probably questions I could call and ask your office, but
that's okay. That's okay. First of all, I just want to ask, how old is your daughter?
She just turned 11.
Okay, all right. For whatever reason, that always helps me with context.
Sure.
So let's see, where do we start with that? Yes, feel free to take this information down and we can talk more in depth, but I do treat pediatrics. I treat all ages from, in utero to geriatric. And where are you located?
In South Charleston. I think you're in the same building back behind where the Kroger's gas station, near down the street from the CVS, I think.
Yes, so there's two buildings there. One is lots of different therapies are in the building across the way, and this is a building where Dr. Zalif and Lau are.
Yep, absolutely. I know where that is because it used to be another chiropractic center.
Yeah. So right now, this work that I've been talking about through this session is funded through a grant. Most of my patients at this point, all my other patients at this point are out of pocket. I worked back in February with an insurance biller, and we submitted a dozen claims to a variety of different insurance companies right before lockdown, and I'm still waiting. And so, the jury is out on how that's going to go. And now the biller herself is having complications in her own life. And so I may be looking for another biller. So, that's kind of an open-ended conversation. I'm always looking, though, to find ways to help. And so we can continue that conversation. Absolutely. Is there anything else about her situation in particular you have a question about?
It's just where I hear you talking about like anxiety relief or repair to the fight and flight responses or the neurogenic bladder stuff, like all of those just start ticking with me with all of the things that she has going on personally with herself. And I'm just like, if this does or can, help relax her or maybe even help get her to communicate a little bit more effectively, I mean, it would be worth every penny.
Great. Absolutely. Well, I very much look forward to connect. What's her name?
Her name is Myanna.
Myanna. Okay. Well, I look forward to, I would look forward to connecting with you guys.
Yeah, absolutely. I'll definitely be reaching out to you.
Great. Thanks, Lisa.
Well, Lisa, we're so glad you joined in this evening. And hopefully this will bring some great relief to you and Myanna and the rest of your family.
Well, and when we're hitting into that, you know, into almost adolescence and through those stages, this is going to be like super important for her to be able to find a way to manage the influxes and the changes that she's going to be going through.
Absolutely. You know, that just reminds me to talk with a little bit. One of the major populations, I just opened this practice in January. And so one of the major populations that I've worked with here in Charleston has been adolescents with concussion. And I had one young female come in and have amazing results. And she had a mom who had a lot of friends and loved to share. And so I got a lot of referrals for young girls with concussion. And I just found that it was really timely, and it was really wonderful to have the opportunity to work with them as they were, you know, beginning to have hormonal fluctuations. And I just, you know, from my own experience, not having support until way afterward, you know, until I was in my 20s, it was just really nice to be able to help kiddos.
That's awesome.
Yeah. So anybody else have any questions or comments? Anybody want to chime in with anything?
Yeah, I also just wanted to comment on what fabulous visuals you have.
Yeah.
Those ones early on of the, you know, the dura mater, the, you know, showing the system, you know, within the skull, that was just, I mean, even though I've been doing the work myself for a number of years, that was such a fantastic visual for me even. So hopefully others found it real helpful to try to see what the system really looks like in there and what you're actually working with within the body, within the cranial vault there. So pretty cool.
Great. I'm glad you enjoyed. And I know that, you know, this audience is pretty diverse, and so I kind of tried to walk a line between giving enough detail and too much detail, and so hopefully I did a decent job with that. That reminds me, KJ, though, there are 2 slides that I hid that I might just share with you. I'll shoot them to you because it talks about the cranial strain pattern in the cranial base, where the sphenoid and the occiput meet, and a side bending lesion, which, you know, most of you just kind of tune out for this, but feel free to. But the side bending lesion is really kind of her primary lesion, which has its origin of dysfunction external to the membrane system. And so it kind of is dependent on working more in the pelvis and with the back injury and the right hip pain that she has than in the membrane system itself. So I actually haven't worked as much with the sphenoid as I might with other patients. But anyway, I'll just shoot you those images for fun.
Oh, that would be great. Thank you so much.
Sure.
Yeah. Anybody else have questions or comments here this evening? Well, I guess not. So Patricia, thank you. This has been very insightful. I hope everybody has found it enlightening, eye-opening, and has raised some awareness for themselves and perhaps for some other folks that they know that they might share this with. This program has been recorded this evening, and the link to watch the recording will be available on the Facebook page for West Virginia Wellness Incorporated. So if you are on Facebook, please go to West Virginia Wellness Incorporated and ask to be allowed to join our private group there. We'll let you in, and then you can view the video and hopefully share some of this information with others as well. Thank you again, Patricia. This has been wonderful, and I hope that one day soon we'll have a chance to meet face to face.
It's absolutely been my pleasure. Oh, thank you so much. It's absolutely been my pleasure. All right, take care.
Thank you.
And good night.
Good night.